Good morning, everybody. Today we are going to talk about an important issue that increased during the pandemic. Our article is about the bacterial resistance to indiscriminate use of azithromycin versus COVID-19, an integrative review. First of all, we need to understand what was happening in the world scenario. By the end of 2019, the new coronavirus, SARS-CoV-2, known as COVID-19, spread all over the globe, starting a pandemic. While scientists studied the structure of the virus and searched for a vaccine, many people practiced self-medication, influenced by fake news and other information available on the internet. And doctors wrongfully prescribed this medication without scientific proof of its efficiency. A recent example of the medication used in this scenario is the azithromycin, which is an antibiotic that has an immunomodulating effect. The indiscriminate use of this antibiotic opens the door to an increase in bacterial resistance to this medication and similar drugs. So, if someone tried to use this medication in the future to heal from a disease, it will probably not work or lose its efficiency because of the bacterial resistance you have now in your body. All because of the irresponsible practice of self-medication. Now, in relation to the methods and material for this article. For informative purposes, articles from the LILACs, PubMed Medline, and Cielo databases were analyzed and reviewed for the structure of this article between 2019 and 2021. 75 related articles were considered, but only 10 were selected for providing data for this study. The other 65 articles had some related information, but not enough to fit this study. Taking into consideration all the information that we had in this article, we can conclude that it is extremely important to inform the population about the risks of the indiscriminate ingest of the azithromycin without a correct medical prescription. It is also very important to inform the doctors about the wrong prescription of these antibiotics. And when they do, there must be a close supervision of how the patient is reacting to the medication. It will be safer to everybody to consume the medication with a careful handling of its effects.
The objective is to describe bacterial resistance by the disorderly use of azithromycin against COVID-19. Results and discussion. Azithromycin acts by binding to specific strains of bacteria ribosomal RNA, interfering with the longest process in the peptide chain during translation and embarrassing the process before protein synthesis is completed by the bacteria. The antiviral effect of azithromycin is due to your interaction with the coronavirus spike protein to prevent it from entering the host cell. Its effect of endosmomal pH adjustments seems to be responsible for the effects of the novel coronavirus on treatment. It shows its activity due to role inactivation. Frequent use of this broader spectrum antibiotic for COVID-19 can stimulate antimicrobial resistance. This patient who uses antibiotic because of bacterial resistance may become infected with superbacteria, which will lead to higher mortality in cases of COVID-19. Among COVID-19 patients, the overall proportion of bacterial co-infections is low, but the use of antibiotics is high, so there's no much evidence to support the widespread use of empirical antibiotics in patients hospitalized for COVID-19 with the risk of excessive use of antibiotics and subsequent damage associated with bacterial resistance. So there is the reference that we used to do this work, and thank you for attention and bye bye.